I'd like to welcome you to a tale of two realities, the age of information and the age of ignorance. A society that is overfed, a society that is undernourished, a people who are the most inactive and sedentary, a people who are perpetually tired and under-rested, an epoch where governments and workplaces demand of their citizens unprecedented personal responsibility, an epoch of governmental and corporate unaccountability. A world so fabulously interconnected through a web of social networks, inhabited by the loneliest generation in recorded history. This tale of two realities is as much responsible for our health and well-being as anything you and I may talk about in my clinic. For years, we have preached the gospel of personal responsibility, for you alone are responsible for your health and well-being, and you alone are responsible for your diet and exercise. Whilst we simultaneously built a workplace, society, and culture, which by its very design engineered inactivity and overconsumption. The narrative of personal responsibility is important, but alone and by itself, it has been an impressive and spectacular failure. Perhaps it's now time to talk about governmental responsibility, organizational and corporate responsibility for the health and well-being of our workers. Good afternoon. My name is Faraz Pathan. I'm a cardiologist and I'm a scientist. I work in one of Sydney's busiest hospitals, and I also work at Sydney University and the Charles Perkins Centre on Research to predict and to prevent heart disease. And I want to share with you some worrying observations. After an initial decline in the rates of heart attacks, these have now plateaued, whereas other diseases of the heart, such as heart failure and electrical disorders, are on the rise. What's also worrying is that our patients are getting younger. There was a time when a heart attack in someone in their early 40s, it was unusual and it was surprising. Sadly, that is not the case anymore. We have to ask ourselves why. Why are we having our heart attacks younger? The rates of smoking have plummeted, largely thanks to excellent public policy. So what is responsible for these heart attacks and this disease and epidemic of cardiovascular disease? Well, the rates of lifestyle-associated diseases such as obesity and diabetes are on the rise. The Australian Bureau of Statistics and the Centre for Disease Control estimate that 30% of Australians and 42% of Americans now have obesity. The Lancet, one of the most prestigious journals in medicine, just this year published a report estimating that there are 500 million people in the world with diabetes. That is scary. Only until you read their projections that within 30 years, by 2050, there will be 1.3 billion people in the world with diabetes. That is terrifying. For context, there were not 1.3 billion people on this planet less than 200 years ago. And folks, we are not ready. The healthcare resources will be stretched, our hospitals will be overrun, and we will drown under the epidemic of lifestyle-associated illnesses and their consequences. But I'm here to talk to you about hope, a drug that is going to stop this and reverse this. A drug that radically reduces your risk of obesity and diabetes. It reduces your risk of heart disease, cancer, even dementia. It is a drug that improves your memory. It improves your sleep. In fact, it improves the performance of anything else you might get up to in the bedroom as well. It is free. It is not patented, but it must be a secret because it is very rarely prescribed by your doctor. Would you like to know what this drug is? Some of you have already guessed it, and I'm going to whisper it because it's important. It's exercise. If exercise is so great, surely all of us are meeting our weekly requirements of physical activity. Just as a reminder, it is 150 minutes a week of aerobic activity, activity that gets your heart racing, and 2 days a week of strength training. Unfortunately, we all know this is not the case. The Australian Bureau of Statistics and the CDC estimate only a quarter of us hit this benchmark. That means 3/4 of us in this audience and online do not meet our requirements for physical activity. Hands up if you're one of those 3/4. I certainly am. And that's okay. Firstly, any exercise is better than no exercise. But I want to take you through my day to see why I don't get this exercise and see if some of these themes resonate with you. Every good day starts the night before, where you plan to win the morning. And I do that. I set my alarm for half an hour earlier because I'm going to get up and go for a run. Exactly. 4 snooze buttons later, I have thoroughly pissed off my wife. I actually get up. I then scroll 20 minutes through mindless social media and then panic because I'm running late. I rush to get ready. I hit the road and I'm confronted by traffic. The average Australian spends about 70 minutes on the road to and from work. I spend about 10 hours a day at work. I again navigate the traffic, which is often worse on the way home. And what does home look like for most of us? Well, if you're in the city, home is an apartment in a high-rise building. And the bottom of that building often is your most favorite and frequented takeaway joint. Exhausted by a long day at work, my willpower at an all-time low, confronted with preparing a meal and having to do the dishes, I grab some takeaway and make my way up. Let's assume I get 8 hours of sleep. This gives me 4 hours to do all of the following activities. Pick up my kids from school or daycare, play with them, read them a book, help them with their homework, sit and eat with my family, then do the dishes with my wife, and we'll do some straightening up, and maybe talk to one another and exercise. And I tell myself I'm going to do this, but I'm tired. I'll watch 1 episode of Stranger Things on Netflix. It's 11:30 at night. I'm 3 episodes in. And the next episode will start in 5, 4, 3, 2. You get my point. In a world dominated by work, by our responsibility to those that we love, and any and all free time monopolized, cannibalized by rapacious algorithms that glue our eyes to screens for profit, one of the things we jettison is our time to exercise. There has to be a better way to incorporate regular physical activity into our lives. What about work? There's a famous saying, do we live to work or do you work to live? Unfortunately, it is not that simple. What if how we work impacts not only how well we live, but also how long we live? Take shift work, for instance. A study in 2018 looked at over 20 different studies of shift workers and found that exposure to shift work, on average, increases your risk of heart disease by 26%. For every 5 years that you are a shift worker, your risk of heart disease rises by 7%. And you may not be a shift worker, but let me share with you people they are, because they're my heroes. They're the nurses I get to work with every day, the nurses that look after our loved ones whilst we are asleep at home at night. They're those whom we call upon in our hour of need. The ambulance officers and paramedics, the police officers and the firefighters. But maybe you're not a shift worker. Why should you care? You hustle, you do long hours, and you're successful. The World Health Organization sees you too, recognizes that exposure to long working hours is common, defined by more than 55 hours a week, and it is associated with a 17% increase in your risk of heart disease and a staggering 35% increase in the risk of stroke. Maybe you're lucky. You don't do shift work, you don't do long working hours. You turn up to your job, you sit at your desk, and you get home at a reasonable time. I've got bad news on that front because in 2018, The Department of Health and Human Services in Australia commissioned a report on physical activity. They found strong evidence linking prolonged sitting, what you guys are all doing right now, to an increased risk of diabetes, heart disease, and death from all causes. Work is important. It gives us meaning and purpose. More importantly, it gives us a way to provide for those that we love. But if work is part of this problem, let's make it part of the solution. And here I'm going to propose a radical idea, even a revolutionary one. A paid health break for all workers during work hours. This is in addition to your lunch break, so that all of us can get the exercise that we need in before the working day is done and return home to our loved ones healthier, happier versions of ourselves. Every time I propose this, I'm met with the same response. This is impossible. It is not going to happen, can't happen, won't happen. I'm a scientist and a researcher. We're in the business of making the impossible possible. Led by my PhD student at Nepean Hospital, we ran a study where we did exactly that. We gave staff time to exercise at work. They could walk around the campus. They could use the hospital gym led by one of our exercise physiologists, or go up and down multiple flights of stairs. Something I affectionately called a stairway to a healthy heart, not a stairway to heaven. Within 3 months, we saw improvements in staff weight, their muscle mass increased, and their exercise capacity went up. There was even a signal, a trend towards improvement in psychological distress. But it hasn't just been us. In 2019, a review of 24 studies where staff were given opportunities to exercise found consistent improvements in weight and exercise capacity. So maybe it is possible, but it's not worth it. We already pay staff to eat lunch. We can't pay them to exercise. It's going to be too costly. Let's talk about cost. In 2016, The Lancet published their estimates on the world cost from physical inactivity. It was $53.8 billion a year. 13.7 billion of this is due to lost productivity. We cannot afford to have a physically inactive workforce. There are multiple dimensions of productivity, but I want to focus on 3. Absenteeism, not turning up to work. Presenteeism, turning up but not doing your best job. And disease-forced attrition, losing our most senior, experienced, and irreplaceable employees to a premature heart attack, stroke, or even death. Can a health break improve absenteeism? Absolutely. In 2020, they found that for every hour in a week your employee exercises, they take 1.2 sick days less a year. Meaning if they exercise 5 days a week, that is 6 less days of sick leave they're going to take in a year. That's impressive, but what about presenteeism? Because that is far more insidious and far more costly to any organization. Well, we looked at this as well. A study in 2008 took employees, over 200 of them, across 3 companies and gave them days where they could exercise days, and days where they did not exercise, business as usual days. Not surprisingly, they found on the days staff were exercising, their mood was better. There's a great established link between dopamine, the love and pleasure molecule, and exercise. What was interesting, though, was that all metrics of staff performance were better on the days where they took extra time to exercise. This data has gone on to be replicated, but surely, if the evidence is out there, companies that are motivated by productivity and efficiency would have noticed, right? Well, they have. In 2019, Business Insider compiled a list of 13 companies that have made key strategic investments into the health and well-being of their staff. I will list 3 and you may know some of them. Nike, the Bill and Melinda Gates Foundation, and Google. The article described that Google runs an on-site staff health and wellness center. Why? Because it makes money, It improves productivity and resilience. And Google knows this. Well, because Google knows everything. I wanted to get to the biological underpinnings of why staff that exercise almost immediately are more productive. And here, I want to share with you my feelings. Have you ever wished that you were smarter, that you had better cognitive function, better memory, that you were more charismatic? I certainly have. I saw a movie where you could take a pill and it would do all of this for you. And I'm here to tell you that there is a drug that does this. And I tricked you before and I feel bad. So I promise you that this drug, this molecule, is not exercise. It goes by a different name. 4 letters. Memorize them, write them down, and if you can get access to this molecule, it will change your life. BDNF, brain-derived neurotrophic factor. This is a performance-enhancing cognitive drug. It bathes our brains. The cheapest and most efficient way to increase your levels of BDNF is exercise. Sorry. I'm specifically high-intensity exercise. So, will we get there? Let's explore other radical or revolutionary ideas which are now commonplace. Historically, people have argued that it's not fair for employers to pay their employees to put down their tools and eat a sandwich. That this is radical. We call this a lunch break. Others argue that the very notion of paying workers to leave work, go away on holidays, and do anything but work is revolutionary. We have a word for this. It's called annual leave. It's your holidays. Up until recently, it was considered radical. You may even say a tad bit inappropriate to turn up to work wearing nothing but your underwear. We call this working from home. What I'm trying to say is that ideas that at first seem radical, even revolutionary, when implemented, often just make sense. So how do we get there? Now, this is where you come in. Because we overestimate what we can achieve as individuals and profoundly underestimate the mountains that we can move working together as a community. This is our battle. This is your battle. You may be a shift-working nurse juggling 2 kids who doesn't get time for exercise. Perhaps you're a data analyst sitting at your desk 8 hours a day, going home to an elderly parent with dementia. Maybe you're a CEO of a multinational corporation clocking 70 to 80 hours, or a politician seeking to overhaul the health of your people, your state, and your country. Let's embrace a health break with the same fervor, energy, and enthusiasm when confronted about our own health. For it is the very health of our society that is at stake. I started by paraphrasing Dickens, and I shall finish with Arthur C. Clarke, a science fiction author, a futurist, who described the typical reaction to radical or revolutionary ideas such as this. First, people will say that it is impossible, can't happen, won't happen. Then they'll say, well, maybe it's possible, but it's not worth it. And finally, once implemented, and people are going on their health break, up the stairs, they're going to say, you know what? I knew this was a good idea all along. Let's skip the first 2 stages, because folks, a health break for all workers, it's been a good idea all along. Thank you.